Good afternoon, everyone. I'm Dr. Carl Lawson with the Office of Excellence and Diversity and Inclusion of Chicago Medical School. I want to thank everyone for attending this today's session of the Health Disparities and Equity in Healthcare and Medical Education Journal Club. As many of you know, we started this past academic year and are continuing this on into this academic year and beyond. And so this is our 10th session. Next slide, please. For those of you that have not been a part of these past sessions, I wanted to point out to you that this session will be recorded. The session is recorded and then reviewed prior to posting onto the CMS Office of Excellence and Diversity and Inclusion website. In addition to today's session, for the remainder of the academic year, we're on a monthly basis. And so October 18th, November 15th, December 13th, be on the lookout for those emails, either directly from Derek Harris or from the OEDI office. Please mute yourself unless you are making a comment or posing a question in a particular time. If you're able to, you can either physically raise your hand or use the Zoom app in order to raise your hand and alert us if you have a question or comment that you would like to make. We start off with a review of the article. There are some interactive poll questions that we encourage you to be active in completing and answering. They are anonymous. And then there's plenty of opportunity for discussion, both during the process as we're going through the slides, and then at the end as well. Next. So the purpose of this journal club is to improve our ability to recognize inequitable practices within U.S. healthcare and medical education, to enhance our ability to articulate why healthcare inequities and health disparities are so important and how we must address them, to translate forefront knowledge to guide clinical practice, research, and education, and to use this as a forum for drawing upon expertise and experience for all participants. And so, although this is through CMS, we invite everyone within the Rosalind Franklin University community to be part of this, our various schools, colleges, and programs. And you will find on these calls that not only do you have faculty members, administrators, students, others, and we welcome you all today, and please spread the word to a colleague, classmate, and a friend about these sessions. Next slide. And so for those of you that are interested in CME credits, you can contact Derek Harris. You see his information listed below regarding CME credits. Next. So this afternoon is with great pleasure for me to introduce to you one of our fourth year students, Yan Han Ren. I will make an announcement in advance. I will not be able to be present for the entire session, but you are within this session. You'll be in Yan Han's very capable hands. I've had the pleasure of interacting with him since he was a first year student, and I will put him on the spot as well and point out that during the Global Health Elective in Taizhou, China, he really outdid himself in terms of supporting his classmates as well as representing CMS, and even went so far to serve as my translator during a presentation to the hospital medical center staff there, and I'm very grateful to him for that. But he is one of our class of 2022 students. Interests include ophthalmology, global health, and international education. And so at this point, I will pass it to Yan Han. Yan Han, the floor is yours.
Thank you very much, Dr. Lawson. So good afternoon, everyone. My name is Yan Han, and the presentation topic for today is COVID-19's racial discrimination and its related depressive symptoms. And this article focuses on the communication about incidents between different people help alleviate the depressive symptoms among Asian Americans. So just a little bit of background information about our story here. So as we're aware, since the onset of COVID-19 back in early year 2020, we have been seeing an increasing number of physical violence and verbal abuses towards Asian Americans across the United States. You can see some of the news articles posted here. Some of the ones that you probably already see on the television, like attacks on elderly women in the street of San Francisco, as well as the shooting in the Asian massage parlor in Atlanta, spiking national outrage among Asian American communities. And the articles here was really interesting to understand if the depressive symptoms experienced by Asian American during those special time period are related to the racial discrimination happening due to COVID-19. So the poll question for today is, have you experienced any discrimination or verbal and physical harassment during the COVID-19 pandemic? And I'll leave the slide here for about 30 seconds for you to send in your answers. I think based on the poll results, we could see that the answer is mostly split half and half. I would say probably half of our audiences here experienced discriminative and verbal abuses during this time period, and the other half had not experienced such experience. So the article was broken down into two main sections. The first part of the article was trying to identify depressive symptoms and the related racial discrimination experiences. And they tried to perform a regression analysis, trying to see if ethnicity, gender, or household information, and other various confounders could be influencing the regression analysis. They were also trying to see if prior discrimination affected the current symptoms experienced by those surveyors. The second half of the article was trying to identify mitigating factors for discriminatory relief. One of the major things they're trying to focus on is trying to see what form of communication for people during this COVID-19 pandemic helped to alleviate the depressive symptoms. And we'll be going into details on the later slides. So the method of this research article was used using online surveys. And then the question being asked here is, have the surveyors experienced any racist, xenophobic attacks, discrimination, harassment, or any other microaggressions since the outbreak of COVID-19 because of Asian race or ethnicities? They received 20 items question for depression, and the measurement for COVID-19 related racial discrimination were analyzed and also kind of compared to the question being asked as well. So the first question being asked here is, does COVID-19 racial discrimination and depressive symptoms really have any significant association between Asian ethnicity and depressive symptoms? So based on their covariate analysis and ANCOVA test, by adjusting for ethnicity, household incomes, they did not find any statistical significant association between ethnicity and depressive symptoms. So that kind of suggests that the depressive symptoms experienced by the people who surveyed are actually pretty significant, are pretty similar across all Asian ethnic groups. By reading the article, I can saw they were breaking down into people who are like Koreans, Chinese, and Japanese. And it seems like regardless of the ethnicity, people all experience similar levels of depressive symptoms during this time period. And the second question the article asks are the association between moderating effects of Asian ethnicity on the relationship between COVID-19 discrimination and depressive symptoms. Even though the results did not show a statistical significance in terms of interaction, it also kind of shows that the effect of discrimination was actually very similar among Chinese Americans as well as any other Asian subgroups. I think one of the major reasons they did focus primarily on Chinese Americans here is that the origin of this virus did come from one of the cities located in China. And I think a lot of the media outlets, especially certain political figures, were kind of stressing on this specific fact, which in a way mitigated a lot of the discriminatory and verbal abuses seen by a lot of Asian Americans across the US. So the article was trying to see, did the Chinese Americans experience a much more significant discriminatory experiences during those times? But it seems like the results suggested otherwise. people, regardless of their ethnic origin, all experience similar discriminatory and depressive symptoms due to COVID-19. The third question analyzed by this article, we're looking into the association between different sources of communication as well as depressive symptoms. And the results did not find statistically significant association with regard to communication and depressive symptoms. So it seems like people who try to communicate their thoughts and their depressive ideas, regardless, still experience depression. But based on the model 4 analysis, but comparing different form of communication to depressive symptoms, they actually found some interesting results that for people who communicate their depressive symptoms, ideas, and opinions with a spouse or partner, it actually significantly buffered the relationship between racial discrimination and depressive symptoms. But for people who primarily posted on online ethnic communiques, disclosing their identities, reported actually a stronger depressive symptoms than those who actually communicated with their spouses. So that's a kind of interesting finding that a strong spouse or family support is actually very important for alleviating the depressive symptoms and also as well as the discriminatory actions during this time. So the second poll question for today is, has your institution, department, or hospital established any mental health support during the COVID-19 pandemic? And we'll be starting the poll. And I think we're towards the end of our polling, so I'll end the poll right now. So yeah, it seems like all our respondents said that their institution department actually implemented a mental health support during the COVID pandemic. That's very nice to hear about the results. So towards the end of my presentation, I actually like to share a personal experience with one of my friends who actually resonated with this paper in a great way. So I have a friend who used to be a Doctor of Audiology student in Chicago. He, like myself, came from Nanjing, China. And he graduated from his degree a year ahead of me. So he was right into the residency program during the peak of the COVID pandemic. So he was finishing up with his residency in Milwaukee Medical College of Wisconsin. And during that time, he experienced severe burnout and depression, mostly due to how the patients and also random strangers treated him. One of the things, like some of the things that patients said to him, said, "I won't trust you with my hearing aids. I want to see a non-Chinese doctor." And he actually experienced several instances where random strangers, where people drive by and roll down their windows and start yelling towards him, tossing ice cubes and soft drinks. He tried calling the police, but didn't result in anything and did not result in any arrest. And as we can imagine, he's the only person studying and working in the United States. He did not have any families. His friends are far away and not in Milwaukee. He did not have anyone kind of to share his depressive symptoms and his opinions during those times. So in fact, he received mental health counseling very late, mostly due to COVID-19. There's a very long queue to see a mental health counselor. And he was I would say this year around April, he was diagnosed with major depressive disorder. Even though he was started with appropriate treatment, I think towards May, he kind of lost his confidence in continuing working in the United States, and he decided to move back to Nanjing, China permanently, and decided not to come back here again. So that was kind of a very touching story for me, because I feel like if I were in his shoes, starting residency early on during the COVID pandemic, I probably would be experiencing similar experiences. I was always wonder what would happen to me, especially as an international student, a Chinese international student studying in the U.S., where very limited family support is here. It must be a very difficult situation to handle through. So here are some of the group discussion questions for today. So what are some of the discriminatory actions you have experienced and observed? And this kind of resonate to our first polling questions. And these are some of the examples I was thinking of after speaking with my friends. There's definitely more, but please feel free to express your opinion as well.
Thank you. Is it okay? Can I?
Yes, please.
Yeah, thank you, Jan, for your presentation. My experiences are not personal, but they are my sons, my daughters, and my husband's. My daughter was driving, and it was a traffic light that was stopped, and the other car near her shouted to her, "Go back to China." And then my son, who is a graduate, he's an alumnus of our university. He graduated from psychiatry, and he was shouted at and saying, "You Mexican, go home." And he was in his car. And then my husband's patients, my husband's a family medicine. He has a couple of Chinese couple that he's an immigration doctor, and he was giving the physical examination and saying that they are fit to become immigrants of America, and they were living in Chinatown in Chicago. They had to move to Berwyn, right near here at the west suburbs, because their house is being vandalized. So anecdotal, but maybe our study is too short because I don't think it's reflective of that. But because my son, my daughter, we talk about it, and my husband is very reassuring to his patients. He did not see signs of mental distress, and the paper is correct. The support of our friends, our family, of the community will help us all. And looking now with our Afghanistan refugees, how much more there will be for them. So us here, even though I am an immigrant, I've been here since 1979. I am very grateful that in all my patients for my public health, I was not discriminated because I am Asian. I don't know how it happened, but I'm grateful that it did not happen to me.
Thank you very much, Dr. Ligaya. Thank you very much for the story as well.
Thank you.
Mhm.
So Yanhan, this is Dr. Chatterjee. Thank you, first of all, for taking the lead on this journal club and choosing the article that you did. I wanted to bring up something that I think is perhaps more pervasive than the overt discriminatory actions that are so egregious that have been described and that are known. I believe that there is far more that is more in the form of microaggressions, subtle put downs, things like that, that also have a significant impact actually on your mental health. And I think are much more difficult to counter sometimes. Something that is so egregious, it's very obvious to everyone what's happening. But sometimes there are more subtle things that are either said or done. They're felt by the person they're directed against very, very viscerally, but they're not necessarily as obvious and are much more difficult to counter. So being mindful, thoughtful, observant of those, and being willing to oppose them when you observe those things happening, I think is a responsibility that we all bear.
Yes, thank you very much, Dr. Chatterjee.
Hi there, my name's Justine. I'm a new BMS student, and Yanhan, I think we actually had the pleasure of meeting last Friday. Thank you so much for bringing this topic to just in opening up the discussion. I think, so I've lived in San Francisco for the last 3 years, and those attacks happened just down the street in an area that I'm very familiar with, and it was very intimate and invasive, and it felt awful to know that a city that touts acceptance and diversity, to have these incidents happen in my city. I think the most, like as Dr. Chatterjee was mentioning, the most hurtful thing for me that I experienced in the midst of that is that the community that I had built and had been working with for the last 3 years, nobody mentioned it. Nobody talked about it in public. Nobody reached out and said, "Are you okay?" or "Are you concerned?" or just opened up conversation. Whereas just in the wake of all of these really tragic killings that were happening and the movement that was happening, the Black Lives Matter movement, everybody was so open and supportive of each other during that time. And I think you're absolutely right, Dr. Chatterjee. It's the little things that kind of go unnoticed that were just so hurtful.
Thank you very much, Justin.
And I'd also like to say, in terms of what I did to help during this time, is that every opportunity that I've had to speak to particularly our students, because I think that, you know, they are a vulnerable population. I've reminded them that the university does have resources to assist with mental health concerns. And I actually found this out by sitting in on a session for our first year medical students. It was a pearls of wisdom kind of thing from their more senior colleagues in medical school. They had this as part of their orientation, and I discovered, listening to the upperclassmen, that actually our university provides a lot more resources than perhaps other places do. He was specifically talking about, I think, a friend or a sibling who's at another institution, and said, you know, they can get a couple of sessions for free and then they have to pay for it. Whereas here, doesn't matter how many sessions you need, those are available for free. The other thing that the university did, which I commend them for, and you know, sometimes we're very critical of our own institutions, as we rightfully ought to be, but in this instance, I think the university did a good job, is to try to find additional support once the pandemic hit last year and the need increased significantly. So we were able to hire a couple more counselors than we had, and I think that has helped not only our students, but our faculty and staff as well.
Definitely, I agree. I think mental counseling, especially for students who are starting far away from the family, is very important. In terms of a situation like this, you know, the ability to kind of express your thoughts freely to someone is very, very invaluable for a lot of us. But thank you very much, Dr. Chatterjee.
Yeah, I was going to say that similar thing, Rin, is that some way we are helping is by having these sessions and by learning about implicit bias and learning, just having open dialogues so we can talk about this and become more informed and reflect ourselves on our own thoughts and actions, and be much more aware of others as well.
Yes, thank you, Diane. So moving on to group discussion 2, what are some of the intervention, counseling, and changes on systematic levels that we can actually help to provide to our vulnerable population? And I kind of posted a news article here. I'm not sure if you read it in the past few months ago, but this is specific to Lincoln Memorial Hospital located in New York City, Brooklyn. 3 of its international medical graduates, residents committed suicide over the past few months. 2 of them are, I believe one is from Middle Eastern, one is from India, and one is from China. And these hospitals program is known for toxic malignancy that did not offer any mental support and way to helping their residents coping with the stress, especially during the COVID-19 pandemic. So I was trying to see for this question, is there some other ways that we definitely talk about mental counseling in the first question, but just curious to know, like, is there any other things that we can help out, like a little things for individuals at risk?
Yes, Yan Han, I have read the same article.
Mm-hmm.
And way back when I was an attending at Cook County, there was one resident who would every year go to human resources and identify foreign medical residents that was accepted by Cook County, and they are the cream of the cream coming from each country. I know the examinations that they take, how difficult they are, and they are really very smart, top of the line. The small things we really do not know coming from the Philippines. I do not know how to pay bills. We don't have that. We have cash. And then I do not know how to do groceries because somebody is cooking for me back home. And then I don't know friends. And I don't have anything very close. I was very blessed because I have a sister here who did all the paperwork so we could come here. But these three in the article that I read, they wrote letters to their friends and they said, I am sorry, I could not just take it anymore. The simplest thing of paying bills or those electricity things, we just do it like routine. It's very difficult for people who just came. It's a total culture shock. So those things, if we are residents, like this is the ramen, this is how I put this together, and if I don't have food, I put water here. Those little things we think is so nothing. These as residents, if we befriend them, and they're shy. I was shy. I do not know the colloquial language of America. Like my patient said, I need to puke. And what is that? And then I learned what it is. That the languages are different. Those words are very different to me.
Definitely can resonate this. I remember, like, I'm an international student from China, and when I was doing my master program in Boston, it was a very hot summer, and the program, the housing hosted by the university did not let us to use air conditioning during that summer because they said the power supply cannot handle in these kind of old apartments. So I ended up sleeping in like a 24-hour library for a week because the heat was too much to handle. I think at that time was, I would say, probably the closest moment I got to leaving the US for good and not coming back here again. But I still was able to receive a lot of support towards the end and helped me to apply medical school one more time. But I can definitely feel like it did definitely those smaller things during our our life here in the US by ourselves are the one that really matters. Yeah.
And then just to jump in, this is Derek over here, Mr. Ren. So if I'm coming in clear and to kind of piggyback on what others have said, it really kind of speaks to sort of the culture of the organization to begin with. We need to start looking at, those of us who work in different industries, our employees, our doctors, our staff, everyone like that. We need to be looking at them, as individual people as well, and not just another number on the list. That's how a lot of people can kind of get shuffled down in terms of getting access to things like mental health, because a lot of people don't feel like, okay, well, if I tell them that I'm going through this, my job could be on the line. I could lose my spot. People aren't going to think I'm good enough to do this, or I may be getting some eyes on me that I don't want. There also needs to come from the institution a culture of openness that, hey, this is a resource for you. This is not a judgment. This is something that we have here for you in order to make you better, not to put you down or anything like that. And that a lot of that comes from sort of just American attitudes towards mental health to begin with. And fortunately, it does seem like, with generations going past, those attitudes are changing and people are becoming more and more comfortable with the idea of mental health. But now mental health in the workplace is going to have to be that new plateau for us to meet, because separating work from your personal life is what so many of us have to, have been doing. But, the world that we're in now, there are certain factors that that can follow you into your work-life balance. And so, letting people know that, hey, if you take advantage of these mental health, facilities or programs that we have available, it's not going to be a negative reflection on you. And it's also going to have to change from the culture from within, where the individual doesn't feel like they're weak for seeking help. I know as a student, it took a while for me to finally get myself in gear to go to office hours. And my life changed immediately because now I knew what I was doing. I think it also has to come from people need to get over that hump of being embarrassed about seeking help and feeling comfortable with going to those facilities that can provide that for them.
Definitely, I definitely agree with the statement. I think like as for a lot of Asian culture, that mental health is really discriminated against, and with often, and also our culture values like holding in your inner thoughts and not sharing with them. I was fortunate to still have the support of my parents. So whenever I do run into issues, I always, go on the call with my families and talk through it. So I feel like I managed myself pretty adequately during this pandemic. But, I would imagine that with the support of our school, this will be a much more invaluable asset to us as well.
So Yanhan, this is a very important topic that we're touching on now, which is the stigma associated with mental health issues. Mm-hmm. And it is actually pervasive across cultures. It's mm-hmm. not just, in the US or in Asia. It is across cultures. Mental health somehow over the past has always been dealt with as being a failing of some kind, as being an inherited disorder of some kind. And so it has unfortunately been put in a separate category than physical health and physical ailments. That is thankfully changing, as Derek pointed out, very slowly in my mind, Derek. It needs to go much faster than we're doing it right now. But you asked in your question about systemic change, Yanhan, and I think that is a very important thing, because societal mores and stigma are, I think, much more difficult perhaps to address. Not that we shouldn't try to do that, but there are things we can do systemically that can be done actually fairly easily. So I'll give you an example of what I'm talking about here. When you apply for a medical license in almost every state, there are questions on that application about whether you've actually ever had mental health issues, treatment, etc. There is an effort afoot right now to actually have those questions removed from those applications, because that automatically would exclude, if you know, and I'm always hesitant with an actual mental health professional on the call. We've got Dr. Hung here. And there might be others that I don't know of, but it's estimated about 25% of the population, at least under normal circumstances before COVID, did have some mental health issues. Paul, does that number sound about right to you?
That is about right. And please continue.
No, and so I wanted to say that you would then have to believe that among physicians and other healthcare professionals, I presume, have very similar things that are asked on their applications, that we are outside of that 25% norm, that nobody has this problem among physicians, which is ridiculous to think about. And I'm going to share with you an anecdote, which I think is illustrative. This is actually one of my classmates who has now retired, but was a practicing physician in this country. And what they shared with me was that they had a major mental health problem, and they were actually receiving treatment for it outside of the system. So essentially, they were hiding the treatment that they were receiving so that their job, their employability was not impacted. So they didn't go through their institution, they didn't go through even their insurance, so that there would be no record essentially of it officially. That, I would say, is a huge gap that we definitely can and should address.
And prior to this, I hadn't wanted to speak up too much because Dr. Lawson has actually asked me to MC the remainder of this journal club because he's in another meeting right now. Hadn't wanted to be the MC and hog the spotlight. But being that the topic has turned to psychiatry, I'll give my commentary on the paper. The first is that I think it was commendable that the authors wanted to use the depression to justify this study. However, being a psychiatrist, I also see a pitfall where some things people may not feel that it's justified to feel unless they can fit it into a psychiatry framework. I think in the context of this paper and this topic, it may have been more than enough for the authors to simply ask, do you feel discriminated and how, and not need to attempt to justify their paper by framing it in the context of depression or anxiety or whatever. The other commentary is that the authors use email, I think, to broadcast their survey requests. That may skew the sample a little. It may even have been more useful for the authors to reach out to community centers in population areas with high Asian American populations and ask them to disperse the survey that way. And that does lead to a point that Justine brought up earlier, which is what can we do systematically? Because this is very obviously not something you can do on an individual level. We're not going to go to each individual and say, don't be a racist. That's not super useful. However, at the same time, we do know that there's a lot of media chatter surrounding the Asian American issue, maybe the beginning of this year, and as Justine pointed out, we don't really see that at the ground level. That is an issue where at the system level, there's a lot of talk about Asian American issues, but there isn't a lot of translation to the ground level. This goes back to the idea where political camps, either left or right, I have seen both, tend to use Asian American issues as sort of beats against the other camps, which is unfortunate because there's so much more to address. Things like underrepresentation in Hollywood or systemic discrimination in leadership and other issues like that. Let's see. I think that's all the commentary I have for now. I don't want to dump it all right here. Please continue.
Thank you very much, Dr. Huang.
I just had an additional comment. Dr. Hung, you brought up systemic changes, and I thought it was interesting that this survey wasn't offered in any other language besides English. If our target audience is, Asian Americans, I think we have very easy access to the technology to translate forms. And I believe it was Dr. Lagaya who mentioned things like paying bills for an immigrant student. If those forms, if websites can just be easily translated into another language, it makes things so much easier and accessible to these vulnerable populations, especially when you're seeing these attacks happen on elderly Chinese people or elderly Asian people. I know my grandma does not read English at all besides, street signs and things like that. It's not going to capture that population.
And I know, if I could make a quick comment, I know that as an institution, we need to listen to our peers and our students and really hear their lived experiences and not project what we think is best in order to help others during these periods of abhorrent discrimination, but really, again, provide that space so that we as non-Asians can share that burden, so the burden is taken off from educating others. Does that make sense? Just really being open to support.
Yes, thank you very much for your comments, Heather. Those are very important. So
I just, sorry.
No problem. Please go ahead.
Thank you. I just wanted to share quickly that I feel humbled to be sitting in on this conversation that I think is incredibly, incredibly important. And I think somebody spoke to this earlier, but I also appreciate the recognition that there's a trickle down effect, that our leaders provide examples of vulnerability in our values. And I think it was spoken about political leadership and that discriminatory mindset. And I think that that's something that systemically is incredibly important, that there's spaces and leaders that recognize that vulnerability and that awareness, and that being informed both about the trauma of discrimination is just vital to setting the tone and setting the stage for how our systems interface with all those that are impacted by the various systems that we're talking about. We're talking about police. We're talking about our political leaders. We're talking about our medical systems, our educational systems, and having spaces that have that mindset that everybody comes to the table with possible trauma. Everybody comes to the table with possible discriminatory experiences, microaggressions, I think is an important mindset. Thank you so much.
Thank you very much, Julie. I think we have reached the end of our discussion here. So I think based on our group discussion, I think we hit all those conclusion points very well. I think the takeaway from today's discussion is, it is very important for us as healthcare providers to understand the struggles that our patients and colleagues are going through, and definitely help to provide additional support to students and workers with special needs during this difficult time period. And we have our next session scheduled for October 18th, also from 12 to 1 p.m., focusing on healthcare disparity and diversity as well. Thank you very much for listening to my talk today. And I'm just going to stop sharing my screen right here. If you have any questions, feel free to discuss as well. Thank you.
Great job, Ian.
Thank you.
All right. We have a few minutes remaining, but people are signing off, so I think it's okay for us to end this a bit early.
Okay.
But yeah, before we do that, anyone have any final thoughts? All right. Thank you, everyone, for joining this first session, and thank you again, Yanhan. Excellent presentation.
Thank you, Dr. Huang. Have a good afternoon.